The SWIFT Direct trial was a trial randomizing patients that were admitted directly to a center capable of direct thrombectomy to additional and bridging thrombolysis with Alteplase in the standard dose of 0.9 milligram per kilogram. And obviously, you know that in all unselected stroke patients, there is a strong time dependency. So patients that get intravenous thrombolysis very early, they benefit much more than patients that get thrombolysis after several hours. This is why we analyzed whether the same might be true for bridging thrombolysis. And we looked into the heterogeneity of a treatment effect of bridging thrombolysis according to quartiles of onset to needle time in those patients. We could not find a statistically significant difference. So in the quartiles, in the first quartile of onset to treatment time, there was no difference to the other quartiles, but this was most likely due to missing power. So we have to join forces with the other trials that compared bridging thrombolysis to direct empty and to see whether there is a signal there if we have a larger sample size. This is in planning. So the collaboration is called the IRIS collaboration. It's the collaboration of all the 5 trials that try to answer the question. It's the Chinese trials, Japanese trials, but also the European trials who join forces. They had some slight differences in inclusion criteria. SWIFT Direct, for example, was only including M1 and carotid occlusions, whereas the other trials partly also allowed M2 occlusions. So there are slight differences, but this is exactly what makes the large collaboration interesting.